All right, good afternoon, everyone. I'm Blake Inscore, Crescent City Mayor, and I appreciate you joining us this afternoon for our community briefing. I have Dr. Rehwaldt, our Public Health Officer, and Mitch Hanna, CEO of Sutter Coast, to here this afternoon to give us some updates, along with Chair Gerry Hemmingsen from the County Board of Supervisors. And so without any further ado, I'm going to let our Public Health Officer, Dr. Rehwaldt, come and give us a community update. Dr. Rehwaldt.
Thank you. The main update that I wanted to talk about today was an order that I signed this afternoon limiting hotels, vacation rentals. It's a pretty long order. People should read it and read it through carefully. The reasoning behind it is what I think is important, and the language is similar to other counties up and down the coast, because a lot of other places in our area are experiencing the same thing. High demand for travelers coming from out of the area, coming from out of state. And the concern obviously is that these people may be trying to flee their own areas that are being affected by COVID-19, but in the same time they may be bringing it with them. And we felt, after a lot of discussion earlier this week, that it was important to try and move on this quickly. I understand there's going to be some people who are probably going to be upset about it, but I think it's better to err on the side of caution than not. And we all understand here that we have fairly limited medical resources. We have an excellent small hospital, but it's a small hospital, and we don't want to overburden our system by failing to take action. So we're following along with a lot of other coastal communities and coastal counties, and I think it's the right move.
Looks like we've got technology. Okay. Dr. Rehwaldt, why don't you just go back to the fact that the order that you put out and sort of the rationale behind it. We had some technological problems here, and I want to make sure that people got that part.
Certainly. In a nutshell, the rationale is that we know that other coastal communities are doing the very same thing. And the idea is to kind of align ourselves with that effort to discourage unnecessary travel, for especially people out of state or from downstate that might be carrying the virus with them. We don't want to make ourselves a target.
Okay.
And Dr. Rehwaldt, there still are no positive tests?
As of today, there are none.
Okay, thank you.
And just another question, Dr. Rehwaldt, the order that you put together, is that up on the public health website, or will it be up there soon where people will be able to read that?
The order goes into effect officially at 5, and
okay.
It should be posted on websites, both I think OES and Public Health.
Great.
So it should be easily found.
Okay, thank you. Appreciate it, Dr. Rehwaldt. Okay, we're going to ask Mitch Hanna, CEO of Sutter Coast, to come and give us an update on what is going on with Sutter Coast as we prepare for this crisis.
Sure. Just in terms of things that are a little bit different than what you might be used to, we have restricted the hospital to visitors only for our any end-of-life patients or obstetrical patients and parents of pediatric patients. So other visitors will not be allowed into the hospital. We have access points. We've limited access to the hospital to 2 locations. So anybody entering the premises would be checked, and we, effective this morning, have started taking the temperatures of all staff. Anybody with a temperature above 100 degrees would be sent home. We don't want to run the risk of potentially infecting any other staff or patients. Right now, our primary focus is on the safety of our staff, of course, because we have to have staff in order to care for patients. We will be, in the near future, in the next couple of days, asking all of our staff in any kind of settings that are close to patients to be masking. and we will be finalizing our surge plan. Right now, our surge plan, we're a 49-bed licensed hospital. Surge plan plans for an additional 20 beds in the event that we should need those. Obviously, we are planning for the worst and praying for the best. And so far, we've been very fortunate in this county. We really have not seen any cases to date. And, hopefully, given some of the measures that Dr. Rehwaldt spoke about and some of the measures that have already been deployed by the governor, we can minimize the spread of the virus in Del Norte County. We also have a number that patients can call, anybody who's concerned that they may be exhibiting symptoms, and I wanted to share that with you. It's our RN Advice Triage line, and that number is 866-961-2889. When patients call that number, they will be speaking with a registered nurse who will provide them with information on the appropriate level of care given their symptoms. In some cases, that may just be how to manage their symptoms at home. In other cases, it will be directing them to the appropriate level of care within the community. We also will actually have within our lab, which is a real benefit, the ability to do testing for COVID-19 within the hospital, which means that we will be able to get fairly quick turnaround times, and by fairly quick I mean within an hour or two. Elsewhere within our system, our labs are being sent to a central lab, and it can take up to 24 hours. So here, because of our remote location, actually that's a little bit of a benefit for us.
Good.
So.
Mitch, while you're here, are you experiencing any shortages of masks or gloves or anything like that? Are we experiencing any of that?
We are actually in a very good position here right now. We are still being very mindful, as every hospital in our system has been asked to, because we do have shortages elsewhere in our system, but we have a strong inventory right now of just about every aspect of protective personal.
Great. And then you mentioned the tests. How soon will you be able to do those tests and get the results back?
We are hoping Monday.
Okay, great.
So.
Good. Thank you.
Mitch, one of the questions that I got yesterday was, what's the deal with the tent? And
Sure.
I just think it would be good. People driving by there, they see that and they wonder what's going on with that. Maybe you could kind of give us a briefing on what you have planned there.
Sure. That is essentially our triage tent. So again, in anticipation of a surge, and hopefully that will not come, but at least we'll be prepared if it does. If our ER gets overwhelmed, it's really an effort to keep patients who are potential COVID patients outside of the confines of the hospital until we have confirmed that. Once we've confirmed that, then we can direct those who have respiratory issues or definitely COVID into the hospital in a protected environment, and those who may be experiencing some flu-like symptoms who can be managed in the tent and then directed home with self-care administration.
Great. Thank you. Appreciate it. Okay. Jerry, anything else?
Nothing more for Mitch, no.
Okay. Thank you.
Thanks,
you.
Mitch.
Thanks, Mitch. I
Appreciate
really
it.
appreciate you coming. Appreciate everything that Sutter Coast does in this community, and especially in a time like this, it makes us appreciate the value of having our own local hospital. So thank you very much. Okay, Jerry, you have a few words that you may want to share before we finish up this afternoon?
Yeah, very short update for those of, I'm Gerry Hemmingsen, Chairman of the Del Norte County Board of Supervisors. I just wanted to, for those of you who haven't heard, maybe give you a little bit of update on what the U.S. Senate and Congress has done as far as relief funding related to the COVID-19 emergency. The Senate and House have approved an economic stimulus bill that will provide relief to citizens, state and local governments. The bill addresses will address people's key needs and needs for the community across the United States. Funding provided by this legislation will be vitally important for the economic well-being of so many. For our local businesses that have been hit hard by the shutdown, please go to preparedelnorte.com and click on the COVID-19 business link. There you'll find resources and assistance in addressing questions and concerns, as well as potential business assistance. People are here to help. Please use the resources being provided. It's important to remember that we're all in this together. We must all do our part to flatten the curve. Follow the recommendations of our public health officer, and continue to use and practice good hygiene. Wash your hands thoroughly, use sanitizer, distance yourself from others, stay at home as much as possible, except for your essential business. Taking these precautions is good for you and good for your community. It's up to us to make a difference.
Thanks, Gerry. Just a
Thank you, Mayor.
couple of things. In conversations with Ted Ward at our Solid Waste Management Authority, we're making available some specified period of time for the transfer station for seniors and those who maybe are the most vulnerable. And so on Tuesdays and Thursdays from 8 till 9 a.m., we're reserving that time at the transfer station for our seniors specifically, and maybe others who are really vulnerable this time, so that we can spread out through the day people who need to use the transfer station. But like we're seeing at some of our grocery stores, such as Safeway, that we provide an opportunity for our seniors, and we're doing something similar in both Klamath and Gasky. Klamath, those times will be Sunday and Wednesday from 10 to 11, and in Gasky, 10 to 11 on, I guess that's the same days. So anyway, the Sunday and Wednesday at both Klamath and Gasky. The other thing that I want to mention is that we will have a special called city council meeting tonight at 5:30. It'll be live streamed on our city YouTube page. You can also go to the Zoom to register if you want to participate with us live during the meeting. We're going to be discussing Dr. Rehwaldt's order, as well as talking about how we at the city can maybe provide some assistance for businesses. We know that this stimulus relief package that's coming from Congress and the Small Business Administration is going to be there to help some of our businesses. But the reality is there may be a gap, and we want to look at any way possible to fill that gap and to step in there if we can as a city to try to help our small businesses. We know that this has been a very difficult time, and we know that there's difficult times ahead economically. So we're going to be talking about some possibilities of how we can reach out and make some help available to our local businesses. So I invite you to tune in tonight. I want to reiterate everything that's been said today. We are in this together, and we can handle this if we continue to work together and if we continue to make good decisions. All the things that Gerry mentioned, I'm going to reiterate. Use good hygiene. Wash your hands. I've washed my hands, I think, more this week than I've washed in the last year, it feels like, at least. But we need to do that. Social distancing, it's a challenge. I mean, even sitting in a room like this and realizing that we're not 6 feet apart, we're 20 feet apart, and we just feel like that's what we're supposed to do, but it does feel odd. But we need to make these decisions. We're making these decisions for each of our health. One of the things that Dr. Rehwaldt said the other day that I've really taken to heart is assume that you're sick and everybody else is sick. If you just have that mindset, you're going to make better choices. And I think that's what we really need to do. We need to make good choices. We got this. We're going to get through this. And I guess I want to be the optimist. I want to believe that when we come through this, the things that we learn and the ways that we work together, we're going to come out stronger as a community than before we face this crisis. So with that said, I will wish you a good afternoon, invite you to tune in to our city council meeting at 5:30 tonight, and we look forward to speaking to you first of next week. Thank you.